Universal Upset Patient Protocol. Step 1. You look really upset. Tell me about it. Step 2. I'm so sorry this is happening to you. Step 3. What would you like me to do to help you? Step 4. Here's what I'd like us to do next. Step 5. Thank you so much for sharing your feelings with me.
Marianne, thank you for coming back in. You have another MRI scheduled for this coming Sunday. Your husband will drive you here. But I just wanted you to come here so that if you had any further questions, that I would be maybe able to answer them for you before you undergo the MRI. You look a little bit upset.
Yeah. My head hurts. I don't understand why I need another MRI because you know what's wrong with me. You got the results back in the first MRI. So why can't you just go in and do the biopsy or whatever it is that you need to do to figure this out so that I can get back with my life? It also doesn't help that if you're going to tell me to be here at 1 o'clock for an appointment, then you should be ready to see me at 1 o'clock. Okay?
I understand your frustration, and I'm so sorry that this is happening to you. To address the first issue, the first MRI told us that you had the brain tumor. The second MRI we'll be doing so that we can more precisely assess the position and location and orientation of the brain tumor in your brain so that we can find out the best manner to go about the biopsy, whether with a needle or with an incision. Does that answer your question?
Yeah, I guess that makes sense. It's frustrating.
Right. And to address your second issue, I understand that we told you to come in at 1 o'clock, and it's 1:35 now, and I don't like to be made to wait either. However, this is a large hospital, and we have many patients, and we like to take our time with each individual patient, explaining what their diagnosis is, what possible treatments there are, and to make sure that, as we did during our last interview, during our first interview, that no patient has expectations that are unmet, and so that we can also assess each patient's understanding of their own situation.
Well, I do appreciate the time that you take and answering my questions, especially with the last session, but what would really be helpful is if you have patients coming in with severe headaches, can you not have children in the waiting room screaming constantly?
Well, I'm sorry, but the pediatrics unit, as you may be aware, is right next to the general practice unit, so there is some overlap in the waiting rooms.
Well, that's really shitty planning.
Well, we do have a breastfeeding room, so that perhaps we can put up a sign in the pediatrics waiting room saying, if you have small children, please don't have them, wandering around the waiting room. Take them into the breastfeeding rooms, not necessarily to nurse them, but just to add another layer of separation sound-wise from the common waiting room.
Just, oh my God, anything, because I feel like my head is just trying to surgically, my brain is trying to surgically remove itself from my skull.
Well,
God.
As scheduled, we'll do the second MRI this coming Sunday, and then Dr. Hattori and I can give you more details on how we're going to proceed from there and our treatment plan to make you better. I'm glad, though, that you shared your feelings with me. It's really important that we understand each other completely as we move forward in your treatment.
Thank you. I appreciate that, and I am sorry if I'm a little on edge. This whole thing pardon me, but this whole thing is absolutely fucking terrifying, and it just doesn't help that I am in pain every waking moment now. So, yeah, I understand. Thank you.
Okay. Thank you for coming again.